Welcome back or welcome for the first time to our Cancer and Nutrition webinar series, Nutrition Basics. Each month, we will briefly discuss a topic regarding cancer, nutrition, and wellness. Today, we will be reviewing some tips and management strategies on coping with nausea. For those of you who do not know me, my name is Allie Farley, and I am a dietitian with VCU and Massey Cancer Center working with the Integrative Health Program. Following each of our monthly discussions, you are welcome to reach me via email, as seen on this slide, at aline.farley@vcuhealth.org. So what do we need to know about nausea? Well, it is a common side effect of cancer treatment, and it can sometimes be accompanied by vomiting and poor appetite. Nausea is typically defined as the feeling of being queasy or sick to your stomach, which can be very uncomfortable and make everyday life tasks difficult. So today we will talk about some treatment options, tips for management, as well as suggestions for foods to try or avoid. However, please keep in mind that the treatment options, tips, and suggestions reviewed today may not be pertinent for everyone, so always talk to your care team. Let's first identify what may cause nausea. It can be caused by specific cancers, or it may be a side effect of chemotherapy or radiation therapy. Other causes of nausea and vomiting include, but are not limited to, pain, fatigue, illness, medications, and the stress of coping with cancer. Feeling nauseous for a long time can affect one's appetite and can lead to dehydration and/or unintentional weight loss. Some treatment options can really vary depending on the possible cause of nausea. So it's important to always start out by talking to your care team about your nausea symptoms to help better identify the best plan of action. If you have nausea due to chemotherapy or radiation therapy, you may benefit from prescription anti-nausea medication to help control symptoms. If your nausea is a side effect of medications, you may feel better when you take medications with food instead of on an empty stomach. If your nausea is caused by anxiety or fatigue, your healthcare team may recommend physical or mental relaxation techniques to improve or decrease your symptoms. There are some tips for managing nausea through diet, such as eating small amounts of food often and slowly. So aiming for about 5 to 6 meals instead of 3 large meals. Eating foods at room temperature or cooler, as hot foods may aggravate nausea because of strong odors. Implementing a bland diet with easy to digest food choices like dry breads and cereals, pastas, rice, noodles, maybe even some canned fruits and vegetables and clear liquids, just to name a few items. These may be a little bit more tolerable. Within the comment section below this video, you will find a great resource with a list of foods to consider for mild to severe nausea. Try eating dry foods before getting out of bed in the morning. Crackers or toast with clear liquids might be a great suggestion. Avoid foods that are fatty, greasy, spicy, or even very sweet. Eat sitting up, chew foods well, and rest sitting up or reclined when your head is raised for about an hour after eating. Drink beverages slowly and between meals. Consider drinking beverages cool or chilled and sipped through a straw. Rinse out your mouth before and after eating. Consider sucking on a hard candy, such as ginger, peppermint, or lemon. Avoid triggers when possible by recognizing times, foods, smells, or events that trigger your nausea, and try changing your schedule or diet to avoid those triggers. If the smell of food or cooking nauseates you, try to keep the room well ventilated. Prepare meals that don't require cooking, just as mentioned before, and create a peaceful eating environment. Feeling comfortable can really make a difference. Last but not least, always talk to your care team about nausea. Don't be afraid to ask questions. Everyone's journey through cancer treatment can be different, and tips on management for nausea can really vary from individual to individual. It's important to try to stay on top of nausea as best as possible. For more information, please check out the following resources, as well as our resources through masseycancercenter.org, or email me at aline.farley@vcuhealth.org. I'm very interested in other nutrition-related topics you would like to hear about, so please comment below this video or email me directly. Thanks again for your time. Our next nutrition discussion will take place in August.